There's the three different approaches you're looking at that we use to treat ALL. There's the induction phase, which is meant to primarily achieve a remission where we can no longer find the leukemia in the blood or the bone marrow. For the overwhelming majority of folks, this is the first step that we take, the goal being to try to rid the body of any leukemia that we can detect with the methods that we have available. In the current era, that still relies upon a combination of multiple different chemotherapy drugs, most of which are given intravenously, most of which have to be given in the hospital because of the frequency that they're given, the doses that they're given, and the side effects that we predict. We certainly hope that at the end of that treatment, we've been able to get someone into what we call a complete remission, where we can't find any evidence of the leukemia in the body, or if we can, it's a very, very small amount. There's consolidation and intensification, which is a phase of treatment used in some of the different protocols that we used. Again, this is basically a way of trying to add to the benefit that was already achieved with induction. It's usually using slightly different medications than was used during the induction phase. Again, hoping to try to overcome any possible resistant cells that weren't killed with the first regimen by using a slightly different combination of regimens. Historically, our results with relying exclusively on chemotherapy have not been so good. A lot of patients are able to get into remission, but unfortunately many of them later relapse. So for a lot of folks, we refer them for stem cell transplantation to try to prevent those relapses from occurring. However, there is a proportion of patients, particularly good risk patients, that we may not necessarily refer them to stem cell transplantation right away. In those folks, we would usually continue on with something that's usually referred to as maintenance chemotherapy, where patients will stay on a much less potent, a much less aggressive regimen, perhaps for a year and a half or 2 years after that initial phase of treatment. But for someone who responded well to their initial treatment, was in remission for some time, and then unfortunately for the leukemia that comes back, almost universally the goal there is to try to get that patient to a bone marrow transplantation, because we think that's the only chance that we have of trying to keep somebody in a second remission. Radiation therapy is very effective at killing ALL cells. The problem is, again, because of the nature of the disease, it floats throughout the whole body, and it's very challenging to give somebody radiation to their entire body. So the way that we typically use radiation in ALL is if a patient has a collection of leukemic cells that's formed a tumor somewhere, we can sometimes treat that specific area with radiation. Another common place that leukemia can present is on the skin. And we have ways of delivering radiation that treats really just the skin. The last big way that we use it is for patients whose leukemia has gone into the brain or spinal fluid. We sometimes can use radiation to treat those areas when other treatments aren't as effective. There are some new approaches to treating ALL. There's one drug that's been approved by the FDA for many years. It's a protein, an enzyme, that tries to eliminate a particular amino acid, which are the building blocks of proteins, that this particular amino acid is really critical to the ALL cells. And this enzyme actually goes around and chews up that amino acid in the system, robbing the ALL of this critical amino acid. It's called Asparaginase. Targeted drug therapy has been one of the really critical improvements in treating particularly adults with ALL in the last 10 or 15 years. And the most specific example of that is for patients that have a very specific rearrangement in their chromosome structure. It's been dubbed the Philadelphia chromosome. Someone was able to develop a drug that has revolutionized the treatment of that particular form of leukemia. It used to be one of the worst kinds of ALL that you could have, and the prognosis for those patients is now significantly better, and it's thanks to a pill that people take incorporated along with the standard chemotherapy backbone. With all of those different approaches, ultimately, the goal is to cure. So unlike many cancers, particularly advanced stage cancers, the intent of treating most adults with ALL is to cure them.